Hello, my name is Wereuche, and I've been asked to make a video about dental health. I'm a dentist in Stamford, Connecticut, USA. I've been a dentist now for, let me not say, oh my God, 20 years. Alrighty. So, my beautiful friends on Oche Kitchen have asked me to give a little talk about dental health and dental care. So, let's just start with the basics, and I will start with what I tell my close friends and my family. When it comes to dentistry, prevention is better than cure. You want to make sure that you are seeing your dentist every 6 months. Don't wait until you have a problem. Don't wait until you are in pain. The reason why I say this is because once you are already in pain, then it's probably gonna, whatever I do, whatever any dentist is gonna do, it's probably gonna hurt you more physically, and it's also gonna hurt your pocket too. So just show up every 6 months so that you can get your cleaning and your checkup. A lot of times you might have some tiny cavities that you don't even need to get a shot for to get filled. But if you wait until you have, a tooth that's hurting, or you have an obvious hole on your tooth, then you probably don't need a filling. Now you might need an extraction or a root canal and a crown, which is obviously, more expensive and more painful. I tell my patients, bring your children in. Take your children to go see the dentist from the very first day you see a tooth in their mouth. This way, they get used to the environment. They get used to the dental environment. Don't wait until your child is about 3 years old before they go see the dentist for the first time. Why? Because if you bring a 1-year-old to the dentist's office, a pediatric dentist or a general dentist like myself who sees kids, it's going to be a pleasant experience for the child. The child does not know fear. But if you wait until the child is 3, which is what, a lot of doctors say that's when we start developing the sense of fear, then they associate, the dentist's office with, something scary. Also, we don't want to, scare the kids before they come into the dentist's office. So if somebody starts seeing the dentist from age 1 every 6 months, I guarantee you that person is not going to have a cavity for their life, so the rest of their life. So that's prevention. Another way to prevent a lot of the problems that I see is you got to make sure you're brushing twice a day, obviously, but also make sure you're flossing. I tell my patients the brushing is for your teeth and the flossing is for your gums. Why am I emphasizing on the gums? Especially when it comes to ndibani. We tend to have a lot of gum disease. And this is because flossing is just something that, we're not taught, growing up. It's not something we form as a habit. And there's a lot of association between gum disease, which starts as gingivitis, the bleeding gums. And a side note, bleeding gums is very common, but it's not normal. Because every other person has bleeding gums doesn't mean it's right. When you keep on having the gums bleeding for a long time, then the tooth supporting structures, the bone under the gum, starts getting affected. And then before you know it, you're in your 40s and your 50s, and your teeth have started shaking. And we're wondering why. an example I always give a lot of my patients. I tell them, you know, the babas you see in the village, and they don't have any teeth, but they never went to the dentist. How did they lose their teeth? They lost their teeth to gum disease. There is a huge unknown association between gum disease and heart disease and diabetes. And it is very, very important that, you know, we try to prevent this. Imagine if you're diabetic and you have to be on a special diet, but then you don't have teeth, or you don't have enough teeth to eat what you like on this special diet. So it kind of complicates the whole thing. You know, I'm very happy to find out now that a lot of cardiologists and physicians here in the US who see patients with heart problems and diabetes always tell them, make sure you go see, you know, your dentist. Make sure that you're getting your cleanings, you know, done. When you're brushing, make sure you're using a soft textured toothbrush. When you go to your dentist next time, ask them to show you, you know, kind of like to demonstrate to you maybe the right way to brush your teeth, or just show them what you do so that they can tell you if